Hey, good evening, everyone. So while I get ready to pull my slides up, just want to say thank you all for attending this night and for all the things that you do every day. And of course, as I've said many times, we would not have an MRC program if it were not for MRC volunteers. So we do appreciate all the great things you guys do and all the different ways that you guys volunteer and serve your community. So with that, I'll go ahead and get started. I think this will be a shorter presentation than typical. I've only got about 24 slides. There is a little part of question answer, a little interaction part for you as well. And when we get to that point, just go ahead and type your answers in the chat. If you have any questions as we go through the presentation, we do ask that you just put those questions in the chat. And if we can get to them immediately, we will. Otherwise, we'll get to them at the end of the presentation. All right, so here's our agenda for today. As you can see, it's already been, we've already gone through introductions, so we'll just get into these other two topics, liability issues, and then safety and occupational health as it pertains to MRC volunteers. All right, so I know all of you got oriented at some point in your volunteer experience, and you were told that you had certain liability protections as an MRC volunteer. And what does liability protection mean? In layman's terms, it means people can't sue you for what you're doing as part of the MRC. That's kind of a simplistic way to say that. A legal scholar would say, well, anybody can sue anybody. It's just a matter of whether it actually has a chance of standing up in court. Also, it also has to go into who's going to be your defendant, or who's going to defend you, I guess, if you are a defendant in a lawsuit. Are you going to be representing yourself, or is the Office of the Attorney General of the Commonwealth of Virginia going to be your strong advocate in that lawsuit? So we'll go through that. Just a little bit of history. I got a typo in my first line already. I'm just seeing it now. So the National MRC program began in early 2002, not 22. My apologies. So 2002 nationally, and that was right after 9/11, 2001, as part of Citizens Corps. And the first MRC units were started in Virginia in 2004. And the MRC was initially envisioned and used as an emergency medical and public health workforce. When I say emergency, that was our primary usage up until recent times. Pretty much a break glass in an emergency. Let's start calling out MRC volunteers and ask for their support. Other than that, we didn't bug MRC volunteers except for to participate in drills and exercises. As you may know by now, a lot of our recent deployments are non-emergency, and we'll talk about how your liability protections occur during both types of events. And again, this isn't just for medical volunteers. So a lot of times when we talk about liability, people think that only applies to medical volunteers, but it actually applies to all MRC volunteers. So liability protections were first added to the Code of Virginia in 2005. So we stood up units in 2004, and by 2005, we already had liability protection in place. So that's how important the MRC program is to the Commonwealth of Virginia. All right, so this is a long paragraph. I'm not going to read the whole paragraph to you, but this talks about how volunteer liability protections are written in the Code of Virginia for declared emergencies. And this is section 44-146.23. And I highlighted some key points. So except in cases of willful misconduct, if you're engaged in any emergency services activity while complying or attempting to comply with this chapter, you shall not be liable for death of or injury to persons or damage to property as a result of such activities. And this includes persons who serve in the Medical Reserve Corps unit or on the CERT team. So some people are also members of their CERT team. This applies as well. And then there's another section of the code talks about immunity from liability, and it again spells out in this definition that Medical Reserve Corps units and CERT teams members are, if they're serving in good faith, will not be held liable for civil damages for any act or omission resulting from such actions, unless, of course, it was a result of gross negligence or willful misconduct. So to sum that up, these two sections, and you can look them up in the Code of Virginia if you're interested in reading the original text as I posted here. But they were both enacted in 2005. They apply during declared emergencies, and it gives volunteers the same sovereign immunity that applies to state and local government agencies and their employees. However, to have this protection, they must be working within the scope of their medical license if providing medical care. And the liability protection does not apply to gross negligence or willful misconduct. And we'll go over some scenarios where we can maybe put a little more clarity in those. I think it's always helpful when people have some real life scenarios to look at that kind of help learn this. So I mentioned emergency response, and early on we looked at the MRC volunteer as an emergency workforce that would occur during emergencies and disasters. But what about supporting routine public health efforts outside of emergencies? And the answer is you're protected there as well. Another provision that was put in place, but also in 2005, provided you with liability insurance to volunteers, including MRC volunteers, that allows you to enjoy the protection of Commonwealth sovereign immunity. So what sovereign immunity means is that as a state employee or an agent of the state, I'm a state employee. I can't be sued directly for some kind of act that I do in my official capacity. Now they can sue the state, and the state can defend the lawsuit, and they're going to ask me for information, and I'm going to serve as a witness, but I won't be sued directly as an agent of the state. And that same liability protection also applies to MRC volunteers while they're acting in the service of the state. And then you see in the definition, it says volunteer in state and local services shall include, but shall not be limited to, any person who serves in the MRC or the CERT while engaged in emergency services and preparedness activities. So the bottom line is that MRC volunteer liability protection applies in both cases where you're in an emergency or not an emergency response, as long as you're working in, quote, state and local service. And this liability insurance provided by the department can be extended to cover volunteers working on behalf of the department. So what that means is, first of all, they can't sue you. They have to sue the state. And the state can defend itself very rigorously. Got a lot of laws that protect the state from being sued by individuals, except in circumstances where the state has specifically allowed themselves to be sued. And even if they do meet the threshold and they're able to gain some damages, that liability insurance would kick in and pay a lot of the costs. So that's what all that means. And again, you have to be working on behalf of the Virginia Department of Health or your local health department. You have to serve as a volunteer without financial compensation. And just a caveat to that compensation note, we have deployed volunteers long distance before, and we've helped pay for those travel expenses for volunteers. Paying travel expenses does not count as financial compensation. So I just want to make that clear. The volunteer has to work within their scope of practice. So non-medical volunteers can't practice medicine, and medical volunteers can only do things that they're licensed to do. There are exceptions where under a declared emergency, we have altered the standards of care, and maybe somebody who's not normally authorized to vaccinate people, like a veterinarian, might suddenly be authorized to vaccinate people, like we did during COVID. And in that case, you would be working in your scope of practice until that declared emergency is over. Once that emergency is over and that declaration is gone, you have to go back to what's your normal scope of practice. And again, you can't be guilty of gross negligence or misconduct. So what about partnerships with external organizations? Almost once a month, or if not more, one of our unit coordinators will have somebody from outside Department of Health, outside MRC, reach out and ask and say, can MRC volunteers do X? And the answer is always yes, but are they serving as agents of the health department if they're serving this other agency? That's the first question that has to come up. Second, are they working within their scope of practice? And then 3, are they not compensated for their work? So if any of those 3 things are untrue, then that volunteer working for that other organization would not have the liability protection that's provided to MRC volunteers that we've discussed. So, we have examples where another health agency, maybe the American Red Cross or the American Heart Association, will ask for MRC volunteers to do a certain thing, or we'll get an ask for supporting, a marathon race, and they want first aid tents. And generally, the way we have to work that is we have to set up a memorandum of agreement that allows our volunteers to work for that agency that says, hey, while they're doing this work for that other organization, they're still serving as agents of the health department. That way you guys get that liability protection. And so that's where, again, sometimes a memorandum of agreement is required. If meals are provided, no, that is not considered compensation. Emergency shelters in Richmond, Virginia. So that was through a sister organization working through the Department of Social Services. And in that case, you guys were deployed at the request of the Department of Health. So you were serving as agents of the health department. All right, so let's go over some scenarios. Like I said before, I think specific examples really help people understand how these rules may or may not apply. So in this first scenario, Sue is an MRC volunteer. She is serving at a local health department influenza vaccination clinic at an offsite location. So she's not at the health department, but she's at an offsite location that the health department has occupied for this mission. Sue is a registered nurse. She has completed all of her VDH immunization training requirements and has been approved to administer the influenza vaccine. While administering the vaccine to an individual named Tom, Tom has an adverse reaction to the vaccine and requires emergency medical attention. Sue provides immediate aid to Tom and asks another member of the team to call 911. Tom suffers a disability as a result of this incident. Is Sue legally liable for the vaccine injury that Tom suffered? All right, so I'm seeing no come up in the chat a whole bunch of times, and that is correct. So Sue is not legally liable for the vaccine injury because, one, she's covered by the MRC liability protection. She's working as an agent of the health department. She's working within her scope of practice. The vaccine caused the injury, not her, and with vaccines, there's a lot of other liability protections that are built into federal law as well. But let's say that the individual had indicated on their screening form that they are allergic to eggs and Sue missed this notation prior to administering the vaccine, would Sue be legally liable for the vaccine injury? All right, so now we're getting into a murky area. Some people are saying no, some people are saying yes. Is this gross negligence or is it just simple negligence? So if it was gross negligence, she would not be covered under a liability protection. But if it's simple negligence, she would be covered. So in this case, the Attorney General for, the representative for VDH would argue this case on her behalf, and we'd probably be able to get this incident dismissed. Either that or the insurance would take over. What if she accidentally administered the wrong dose of vaccine? Like Tom was a kid and she gave him the adult dose. Right. So yeah, so again, the liability protection would apply again if it was a simple act of simple negligence or even just a honest mistake. She would still be covered for liability protection. All right. So that was a fairly straightforward case. Now we'll get into how do we go from okay. I don't know why it says scenario 5. It should be scenario 2. I was wondering if I skipped the slide. All right. So Joan is an MRC volunteer and a registered nurse. Her local MRC unit has a memorandum of agreement in place to partner with the American Red Cross to conduct health awareness events, which include free blood pressure screenings. Joan has been activated and deployed to support one of these events. While on this assignment, Joan provides a blood pressure reading to an individual named Mark who has come to the event. That reading indicates that Mark's blood pressure is in the moderately high range. Joan advises Mark that he should follow up with a physician. The next day, Mark suffers a heart attack and dies. Is Joan legally liable for Mark's heart attack? All right, and I see the answer is no. A good resounding no. So number one, she didn't do anything wrong. She took his reading and gave him the answer and told him to contact his doctor. And she was deployed as a member of the MRC because the agreement was in place with the Red Cross. I'm sorry, the Heart Association. This is a health department employment. So she is representing VDH in this mission. And she's not acting in gross negligence. Now, somebody might argue if his blood pressure was extremely high and, she just said, oh, it's high, don't worry about it. Possibly there might be some issue there. Although still it's unlikely that Joan would be legally liable in that event. All right, so here's another example, and again, this is scenario 3. Paul is an MRC volunteer and a licensed general practice physician. Paul is participating in a marathon event as a runner. A terrorist attacks the event with a bomb somewhere on the course. Paul suffers only minor injuries from the blast and begins to provide first aid to other victims. Despite his best efforts, one of the victims Paul treats succumbs to her injuries. Does Paul enjoy the liability protection as an MRC volunteer in this scenario? All right. I'm seeing no's, but I'm seeing a few yeses. All right. The answer is no, he does not enjoy liability protection as an MRC volunteer in this scenario because he was not deployed as an MRC volunteer. However, he would be protected under Virginia's Good Samaritan laws, and some people have pointed that out. And so I think he would have pretty easy time defending that lawsuit if somebody were to try to sue, which is unlikely, by the way, in these types of events. Yeah, so you guys have answered that why or why not. So again, it's not MRC volunteer protection, but Paul's not doing anything wrong. He's doing his best to save a life, and he's protected under the Good Samaritan law. All right. All right, Andy is an MRC volunteer and has been a registered nurse. However, Andy's license to practice as a registered nurse has been revoked by the Virginia Department of Health Professions due to previous misconduct. Andy still wants to volunteer with the MRC, so he does not tell his MRC unit coordinator that his license was revoked. An opportunity to deploy as a registered nurse becomes available, and Andy signs up and deploys as a vaccinator. While administering a vaccine, Andy makes a mistake and causes an injury to the patient. Does Andy enjoy liability protection as an MRC volunteer? I'm seeing a whole lot of no's, which is the correct answer. So in this point, he's guilty of a couple of things: working outside his scope of practice, and probably gross misconduct because he lied about his license. So is Andy legally liable for the injury to the patient? Yes, he could be. If he were sued, he would be on his own to defend the lawsuit. He would not get assistance from our Commonwealth's attorney to help defend him. All right. Last scenario. Mary is retired RN who has a volunteer license on file with DHP. Volunteer license means that, whilst her normal RN license has expired, but she has a volunteer license, which means she can only practice as a volunteer. So she is still eligible to deploy with MRC and work as an RN as a volunteer. However, she sees on the news that an emergency has just been declared in the next town over. Mary is anxious to help and self-deploys to the scene. She encounters people in need of immediate medical care and applies the Stop the Bleed training and CPR training that she received as an MRC volunteer. So is Mary entitled to the MRC volunteer liability protections in this scenario? And the answer is no, because she's self-deployed. And that's a no-no, as you know, from your orientation training. Is she legally liable for any injuries she may cause while providing cares to victims? Maybe. It is likely that the Good Samaritan laws could apply to her. However, we do not advise anybody to self-deploy to any emergency or disaster because other bad things could happen. So, the scene may not be safe for Mary to be there, and she may become a victim of the scenario herself, and then requiring additional resources for somebody to come and provide care for her. So that's a threat there for her own safety and well-being. And then also, we would not be able to provide that legal protection for her as an MRC volunteer, which means the Commonwealth's attorney would not be there at her trial representing her for free, but she would have to pay for her own attorney fees if somebody were to sue. Now that's, again, it's unlikely. If somebody's trying to save your life, usually you don't feel the need to turn around and sue that person, especially if they're doing a good job at it. But again, she would not have protection as an MRC. So even though my slides were mislabeled, you all did a great job of answering the scenario questions. So kudos to you. You've all been paying attention and you know your stuff. So let's move on to safety. So we've talked about protection from legal liability for the care that MRC volunteers apply to others. But what happens if an MRC volunteer gets injured? And first of all, before we even get to that point, how do we prevent injuries to our MRC volunteers? Because, an ounce of prevention is worth a pound of cure. And so we don't want volunteers to get injured. So here's some of the safety considerations. And again, um, this is mainly addressed to those health department leaders, that local emergency planner, that unit coordinator, but this is good for volunteers to know, because when you go into an environment, these are the things that you should be looking for, um, that might cause harm to you, that you want to avoid, you know, and protect other people from, and protect patients from, or clients of the, you know, if you're at a shelter or other place where there's clients coming in rather than patients, you want to protect them from these environmental hazards, such as, you know, slips, trips, and falls, potential for electric shock, thermal burns, or chemical hazards. If you're working outside, weather conditions can be a factor. If you're working around vehicles or parking lots or moving traffic, drive-through events, definitely want to look out for how those things might occur and how they might be mitigated. Um, Potential for head injury. So if you're working around things that might be falling, you know, protective headgear might be needed, or maybe we need to move our work area to somewhere where there's not a danger of things falling on your head. And then work-related hazards that might apply to MRC volunteers. So exposure to blood or body fluids, needle sticks, and lifting injuries. We do see about once a year MRC volunteer stuck by a needle that's been used to administer a vaccine, or you know, something else, and that's something that we want to avoid. So, you know, proper technique, not recapping needles after they're used, putting the needles directly into the sharp containers. Those are things that we can do, and making sure we have adequate sharp containers on site, and that we replace them when they start to get more than 3/4 full, or right at the 3/4 mark. That sharp container should be removed, and an empty one put in its place. Lifting injuries can be avoided through proper lifting techniques, using the buddy system to lift, or just having somebody who's in better physical shape move something if it's really heavy. Um, Setting up your site, you also want to look at fire safety. So, you know, sometimes we occupy older buildings that have been abandoned. Maybe it was a school once, maybe it was a library, but the county, you know, has kept the building for things like mass vaccination clinics, or other things. Um, Maybe those exits aren't clearly marked anymore. Maybe the light bulbs and the exit signs have burnt out. Um, Maybe the fire extinguishers that are there are really old, haven't been serviced. Um, and so those are things that we're going to want to look for and mitigate before we bring staff and volunteers onto the site. Um, you know, do the fire alarms still work? Did they turn them off because the building's no longer occupied? Those are things that we want to ask the building manager about before we occupy the place. And we want to brief the fire evacuation plan to all of our staff and volunteers as soon as they get on site, because we don't know when an emergency is going to occur, and there's not more time for safety later. So first thing we want to do is we want to brief our volunteers on the fire evacuation plan, and we want to mitigate, you know, trips, slips, and falls by quartering off unsafe areas. If there's a hole in the floor, you know, we want to mark it off so people don't fall in the hole. We want to keep our floors dry. We want to clean up any spills as soon as they occur. We want to keep wires and cables out of foot traffic areas. If we do need to run wires across walkways, we have cable protectors that are, you know, little ramps that are built on both sides of the cable. And then training. So we want to ensure that all of our staff and volunteers are trained on safety techniques and how to use their personal protective equipment, or PPE, properly. And we don't want to just tell people, oh, there's masks and gloves over here, and make sure you use them correctly. We want to actually demonstrate the techniques. We want to observe the team members performing those techniques, so we know that they actually have that down pat. We want to allow time for questions in these safety briefings, and we want to include checks on learning. So a check on learning could be simple as just a back brief. hey, where's our fire extinguisher? Like you've told them where it is. Now you're going to ask a volunteer. So where's our fire extinguisher? Where's our emergency exit? You how do you, let me see you put on that mask. Let me see you take it off using the right technique. And then in some cases, we might have to ask for health screening. So, um, like one specific mission when we do tuberculosis, um, you know, outbreak investigations, we want to test all of our staff and volunteers before and after that event so we can see if you convert it to a seropositive. And that way we can make sure you get the prophylaxis that you need. And then in some cases, we might require or recommend that you get a vaccine prior to working in that specific mission. During COVID-19, we had a requirement for the COVID vaccine. And then at some point later, that requirement was removed, and that's no longer required. For some of our clinics, if people want to work within the health department clinic during flu season, we require that you either get a flu vaccine or sign the declination form. So, and if you sign that declination form, you're kind of working at your own risk at that point. All right, so somebody asked, what happens if volunteers do have injuries? And what's the liability? What protection do the volunteers have? So here's the first thing we need to do is we need to apply immediate first aid to that volunteer to mitigate whatever that immediate risk to health and safety is to that volunteer. Evacuate to higher level care as needed. So that means in many cases calling 911, having that ambulance come and pick that person up and bring them to the hospital. Again, only if it's really necessary. And that's a judgment call you have to make depending on the type of injury. We want to document the injury. So we use what's in VDH, we call it the client occurrence reporting form. So even though volunteers are working as staff, we actually have to use the client occurrence reporting form for volunteers as well. Don't ask me why that is. It's just our procedure. And it used to actually be a form. Now it's a red cap survey done, through the internet. When volunteers get injured, we do expect them to use their own health insurance to pay for their immediate care. And then, co-pays, deductibles, those kind of things they would come back to us for reimbursement. How do we reimburse volunteers? Basically, they have to seek a claim against our Commonwealth of Virginia Risk Management Plan. And so we've insured ourselves as a state for up to $100,000 for each tort claim. So you have to make the claim against that. We can't guarantee that Commonwealth will pay that claim because they fight it. There's a different set of attorneys that aren't us that try to fight paying out claims in order to save the Commonwealth money. But that's the system we have. And a lot of times we get asked about workers' compensation. VDH does not currently provide workers' compensation to MRC volunteers. So workers' compensation is payment for missed work. And because you're a volunteer, you don't get paid to volunteer, we can't pay you for the times you can't volunteer, if that makes sense. Now, you may say, well, I've got another job and I can't work at that other job now because I got injured. And that's, unfortunate. And again, you can make that claim against the Commonwealth, but we can't provide out workers' compensation. Now, that claim might get you some damages that address that lost work, but we don't provide, like I said, workers' compensation. It's a specific type of insurance program that we don't have. Now, some of the local governments have this and they do provide it to their MRC volunteers. And so you're going to have to ask your local MRC unit coordinator in that case if it applies. But as a state level, we don't provide it. And then some mental and behavioral health considerations. Now, not all injuries are physical, and so MRC volunteer responders may experience psychological trauma through stressful situations, direct experience with traumatic events if you're, involved when something bad happens directly. And people can get what they call vicarious trauma, where if you're interacting with a survivor and you're hearing all of these horrible negative stories over and over, sometimes that can get to the volunteer. And you yourself can start having nightmares, start having anxiety, and those are kind of normal reactions that people might have. Um, and depending on the scenario, you might get moral injury from the inability to save everyone. So if you're working in a mass casualty response type thing, and people are coming in, and there's a lot of people that need treatment, but we don't have all the doctors and nurses and supplies and equipment to treat everybody the way we normally would. Sometimes medical professionals can feel guilty about that afterwards. And so that's just something to be aware of that could affect. And most people don't know if any of these things will affect them until it does, unfortunately. Some prevention techniques, good communication before, during, or after deployments. So if responders know what they're getting into ahead of a deployment, and they get a good briefing on what the situation is, and then they can mentally prepare themselves for what they're going to see, hear, and smell at that event. Sometimes that can mitigate that psychological trauma that occurs. Similarly, if they have a chance to debrief after a deployment, and talk about their experiences with others, particularly those who've gone through the same ordeal with them, that could be helpful as well. Being part of a team, or pairing with a teammate, especially somebody who's got maybe more experience than you if you're unexperienced, or somebody with similar experience with you, if you are experienced, that can help reduce some of the stress and some of the the issues that you might face in that response. And then you've got to meet your own immediate physical needs, and that includes food, warmth, shelter, security. So take breaks. So don't think you have to be the hero and save everyone on the planet before you take care of yourself. So do your shift, take your breaks, get food, get shelter, get warmth, go to where you feel secure, and then be ready to respond again at your next shift. So again, adequate work rest cycles are a big part of that. Post deployment, one of the things that we're going to be implementing very soon is an automated post deployment survey. We did use these sporadically during COVID, to get an assessment of the whole volunteer experience. So we want to know, from everything from alert through pre-deployment instructions, through deployment, redeployment, how your experience was. And that helps us as the MRC team to make these deployments better in the future, to learn and improve our work. But we also are going to try and identify, do you need debriefing services, and then work to bring in counselors to help with those. And then, help seeking behaviors. These are important for everybody, whether you're experiencing emotional or psychological trauma. Help seeking behaviors are always a good thing. People could always use help with whether it's, quitting smoking or alcohol or drugs, or just improving their health, getting better sleep, taking care of their, immediate and long-term medical needs. These are always good things to do, but especially important post-deployment. And that brings me to the end of the presentation. So I told you this would be a shorter one, but we do have time for questions, and I'm going to end my slideshow. That way I can see the chat better.
Yeah, I think you've gotten all the questions that were in the chat so far, so good keeping up.
Yeah, I can only see them. They flash up on the screen for like a second and then they're gone. So if I missed any, I apologize.
Oh, there is one. Did you see the one about what if someone is out of control and injures an MRC volunteer? And then people carrying guns, people with mental health issues are angry, rowdy children.
Yeah, so, part of that mitigation effort is having the resources on site to respond to that. So in a lot of our points of dispensing operations or mass vaccination clinics, we do have security teams on site. That's usually worked out with either the local police or sheriff's office. We have used private security at some of our COVID pods as well. But that's something that we would want security there to protect people from that. Obviously, you can't stop every incident from happening. We do try to also employ, what do you call it when you talk people down? Crisis intervention, techniques.
Like de-escalation.
De-escalation, that's what I'm looking for, yeah. But yeah, so injuries, can occur. We can't prevent all injuries, but we do try our best. I see a new question came up. I was referred by Greater Richmond MRC to Special Olympics of Virginia last summer and volunteered for SOV. I'm not sure what SOV is.
Special Olympics of Virginia.
Oh, okay. Yeah. If that opportunity presents itself again, should I ask for an MOU between MRC and SOV to be fully covered under my scope of practice during the SOV events? So it's not really up to the volunteers to get the MOUs worked out and signed. The MRC unit coordinators work with their local health district leadership and with the state leadership to make sure those agreements are in place, that they're approved by the Commonwealth's attorney, and then we deploy people to those events. Now, some events we may determine that an MOU is not needed based on the nature of the event. So if it's a volunteer working on behalf of the health department in support of an event, that's different from saying, okay, you're going to go sign in with that volunteer agency over there and work as their volunteer. In that case, you would not have MRC liability protection if you were to just simply, like, sometimes we get requests for volunteers and we send out an alert that says, hey, if you're interested, this organization is looking for volunteers. This is not an MRC deployment, but if you're interested in volunteering anyway, here's their website where you can sign up. Now, their organization may have some protection in place to protect you, whether it's an insurance program or a policy that says, hey, you can't sue our staff, but you can sue us directly, something like that. And so that's something you can ask that other organization for. Hey, how do you protect volunteers should something bad happen during this deployment? And if you're not happy with their answer, then don't volunteer. Should licensed professionals who are retired consider having professional insurance just in case? Well, I guess the question is just in case what? So you don't need it to volunteer as an MRC volunteer. But if you're going to provide care outside of MRC, then yeah, it might be a good idea to have professional insurance. Some people do volunteer with like fairly qualified health centers, right? So that's not an MRC deployment, but it is a volunteer experience, and you are protected to a certain extent under that organization's liability protections, but you would not be an MRC volunteer. And maybe in that case, you might want some professional insurance depending on what that other organization offers.
There are some units that do have MOUs with those kind of organizations, though.
Yeah, and if they have an MOU and you're deploying as an MRC volunteer supporting that external organization for a public health purpose, then you're protected as an MRC volunteer. And you'll know because your deployment request will come from your unit coordinator or a regional coordinator, someone from it'll come through VVHS. And that's how you'll know that this is a deployment that's on behalf of MRC. And if you get that, you're good to go, because they won't deploy you as an MRC volunteer if it's not a valid mission. But good questions. I see a comment here says, when I was injured while donating platelets, my health insurance company wanted to speak to the Red Cross Insurance's company. Yeah, and that's perfectly reasonable. I mean, the Red Cross is a private organization. They're not, we have, agreements occasionally with Red Cross for volunteers to work at their events, but we couldn't do anything about Red Cross's insurance policy. If a health insurance company wanted to come after the Commonwealth for damages so that they could reduce the amount they have to pay out on your claim, they would have to, file a claim against Virginia's tort insurance. And again, that would be outside the MRC scope to argue that either way. That would go to the Commonwealth's attorney to litigate that event.